Hello, this is Dr. Gil Wilshire at Missouri Fertility. Welcome to another installment of our Frequently Asked Questions series. Today I'm going to be talking about a very common test called a hysterosalpingogram. That's a real mouthful, isn't it? So we just call it an HSG. A hysterosalpingogram means it's the study of the uterus, which is hystero, salpingo, which really means trumpet, well, that's what tubes look like, and gram is a picture. So it's essentially a picture of the insides of the uterus and the tubes. Obviously, if a woman wants to get pregnant, we need a fairly normal uterus and open tubes for this to occur. Now, the basic female reproductive system looks something like this. There's a uterus with an inside cavity called the endometrium, and then these two little tiny tubes that go out. Now, how do we determine if these are open and fairly normal shape? Well, it's fairly straightforward. If we take an X-ray contrast dye, put a little nozzle in the cervix, inject the dye, and have it go up inside the uterus and out the tubes. And if this happens normally, we get a picture that looks something like this. An image, it's essentially a negative image of the inside, essentially of the plumbing. So contrast dye actually blocks the X-rays. So you end up with a picture where you see the cervical canal, the inside of the uterine cavity, and if we're lucky, we see these skinny little tubes coming out here that then get wider and wavier. These waves are important. And then we see the dye spilling out into the tummy. And this is a normal hysterosalpingogram. The dye gets absorbed by the lymphatic systems and is gone in essentially a day. So we get an image of the insides. It'll tell us if the cavity is fairly normal, and if the tubes are open, it tells us something about the shape of the tubes, which is generally helpful information. Now, this study does have a slight amount of risk. If the tubes are blocked at the end, and you've got what we call hydros, if the dye goes up here and gets stuck, you can end up with an abscess. That can be life-threatening. So we like to make sure the risk of this is low. If a woman has suspicion of tubal damage or hydros, we do not like to do this procedure. I have seen complications when this is done. Some doctors do this with a balloon. Instead of using a nozzle in here, they will put a balloon inside and a catheter inside the uterus here. And in these cases, you see an image that looks something like this. You don't see any of this, and you see the upper uterus and the tubes. Now, I'm not a big fan of the balloon because the balloon gets in the way of all this information, and it can get in the way of polyps and abnormalities down here, but it's certainly better than nothing. Now, women hear about this study and they hear, oh my God, it was so painful. Well, it generally is not when I do it. Some of the reasons for pain is one is there's a doctor who's not comfortable doing this procedure. Sometimes radiologists do this procedure. They're frequently not comfortable doing this kind of thing. It takes them long. They don't have the tricks of the trade. And they're trying to put balloons up here, which causes its own pain. When I do this procedure, it takes maybe 45 seconds. It's associated with a little pinch, a little cramp, and then it's over with. Now, sometimes it hurts a little more if the tube seems to be blocked and we push the dye a little harder. Then sometimes the dye will come out, wash the tubes open, which is one of the benefits of the procedure. That's when it might hurt a little bit more, but generally it's not too bad when an experienced doctor does it. One more thing you need to understand. I see women all the time who have had this study done and the doctor who did it said, you're normal. Well, the dye study might be normal, but it doesn't mean you're normal. This is called a false negative test. Unfortunately, you can have a normal histogram, open tubes, normal cavity, and still have disease and scar tissue out here seriously affecting the tubes, even though the dye study is normal. So don't fall into that trap that a normal study means you're normal. Also, sometimes you'll have what are called false positives. We'll see what appear to be defects in the uterus, and these are just air bubbles. Sometimes we can see what appears to be pocketing out here, but really is normal. So these are false positives. So just realize these tests are not perfect. They need to be interpreted by an experienced doctor doing it, but generally we get very good information, and it's a much easier procedure to do compared to surgery or laparoscopy. So that's the hysterosalpingogram, a very common study. We do them a lot here. We're very good at it. We get some good information when it's indicated. I hope that's helpful to you. This is Dr. Wilshire of Missouri Fertility.